All right, good afternoon and welcome to our Team Kentucky update. We have normally started the Team Kentucky update with talking about good news and then moving into the tough news. But the Delta variant is surging, burning through our population, sending record numbers of people into intensive care units. So today, that's where we will start. To our south, where it always starts, where we can see our future. We are continuing to see state after state after state not only get very low, but to completely run out of intensive care unit beds. This is Alabama, the latest state. We've talked about Mississippi. We've talked about Texas and Florida. We've talked about Arkansas. It is happening absolutely everywhere. And in Kentucky, our hospital capacity, really the capacity that we have based on the staffing that we have, is reaching a critical point. Yesterday, we passed a record that none of us wanted to see, and we had more people in the ICU yesterday fighting for their lives from COVID than we have had at any point during this pandemic. Think about that. This is happening at a time when we have vaccines that are very good at preventing you from ever ending up in an ICU. What it again means is it's the most dangerous time if you are unvaccinated in this pandemic, maybe in your life, to getting very seriously ill and perhaps not making it. So we're going to hear via video from 3 different hospitals and healthcare organizations today about the real challenges they're facing. And I hope that seeing that hospitals are to a point where they might not be able to help you if you are in a car wreck or otherwise harmed will somehow get through and lead to more people getting that vaccine that helps protect us all, not just from COVID, but helps protect us from anything else you might need hospitalization for. So today, we're going to start with Trisha Smith, Director of the Appalachian Regional Healthcare Command Center, you're about to hear from, who has answered many of the calls of patients who need a hospital bed and she can't find them. Here's Trish.
My name is Trisha Smith. I'm the Director of the Appalachian Regional Healthcare Command Center. Our transfer center helps physicians find hospitals for patients who need a higher level of care. The hospitals that we usually call when patients need that higher level of care are now calling us looking for available beds. I hear the distress, the worry, the concern in their voices. The patients will die if they don't find the right level of care soon enough. We are all struggling with limited resources, including limited hospital and ICU beds. Our hospital system is almost at full capacity itself. Like other hospitals across the country, we are also filling up with unvaccinated COVID-positive patients. Around 97% of the COVID-positive patients in our hospitals are unvaccinated. I am deeply concerned that we will not have the capacity to care for the next trauma patient, the next family member that has a stroke, the next neighbor having a heart attack. I urge you to get your COVID vaccination if you haven't done so already.
I hope Trisha's words sink in, that her system, not an individual hospital, is nearing capacity, and she worries that there won't be the availability for that family member who suffers from a stroke or is otherwise harmed. It's not just me as your governor talking to you about it. It's the actual people that are running these hospitals, trying desperately to get everyone vaccinated so that they can take care of people. Next, we're going to hear from Med Center Bowling Green. The team at Med Center Health in Bowling Green has been on the front lines since day one. They show up daily, and they've even suffered a loss of 2 of their own. Dr. Rebecca Shadowin, an infectious disease expert, Dr. Don Miller, an ER doctor of 17 years, both paid the ultimate sacrifice while caring for and treating patients with COVID-19. If I remember right, they may have lost another individual as well. The virus is deadly. Yet our brave healthcare heroes continue to show up even after they have lost their colleagues to protect us. Now, they need us to step up for them. Today, Dr. William Moss, Director of Med Center Health Emergency Department, and Katrina Wood, Chief Nursing Officer, are sharing their message on where hospitals currently stand on capacity and what it will take for us to turn this surge around.
The Medical Center at Bowling Green is at capacity. The critical care units are full. We are unable to accept patients from outlying facilities that we normally take and that need our help, and we want to be able to help them. Our emergency departments have patients holding for critical care almost every day. The way the community can help us to be able to take care of you is to get vaccinated.
And one of the things I wanted to stress to our community is that you're doing this not just for yourself. This is a community. We all live here together. This is a population of Kentuckians, your neighbors. We're all trying to do this together. And when we're crowding a hospital with COVID cases, that's somebody's neighbor whose arm is broke who'll have to wait longer. That's somebody whose neighbor is going to have a heart attack and possibly have a delay. That's somebody who's going to have a stroke, and because EMS is full of runs, they're not going to get to the hospital as quickly as they can. We're really doing this not for ourselves, but for our community. I don't feel it's proper to bully people. I don't feel it's proper to, to make someone feel guilty because they're not getting it. I just want them to realize that this is something we're doing for each other. It's not an individual thing. It's a community thing. So I really encourage everyone to please consider getting the vaccination. And if you have questions, ask about it with your doctor. And don't be hesitant to even call or ask me if you know me. I'll be happy to answer any questions for you. But it's a process that we need to consider others as we consider ourselves. It's very important. So I urge everyone to get the vaccination.
You can see and hear the exhaustion from these incredible folks. That's something I want to talk about in a minute because it's something we ought to be able to help with. So for months, Dr. Stack and I have been telling anyone who will listen to get vaccinated. But you don't have to take our word for it. Listen to nurses, doctors, and hospital leaders on the front lines that are encouraging vaccinations while they are taking care of your neighbors in your community every day. So our last video is from members of the Baptist Health Hardin in Elizabethtown team. It's Dr. John Godfrey, Vice President and Chief Medical Officer, Sharon Wright, who's the Vice President and Chief Nursing Officer, and Dennis Johnson, President and CEO of the hospital system. As of this morning, Baptist Health Hardin has 91 patients battling COVID. For comparison, during the surge in December, the highest day they had was 56. That's almost double the worst that we saw before. And out of the 20 ICU or critical care unit beds of Baptist Health Hardin, 18 are currently filled by COVID patients. That's 18 out of 20. And almost all of them are unvaccinated. With the Delta variant surging, COVID-19 is causing extraordinary hardship on these nurses, these doctors, and these hospitals, unmatched at any other time in this hospital's history. To this team, my goodness, thank you. And all of you, thank you. We're going to talk about that again in a little bit. But for all of you, we should all get vaccinated.
Here at Baptist Health Hardin, we're feeling the strain of the most recent surge of COVID-19.
We're seeing a significant increase in the number of COVID patients, both in the hospital and in our outpatient clinics. These patients are occupying over a third of our hospital beds. In fact, we're using high flow oxygen and ventilators at rates that we've really never seen before in this hospital. We sincerely want our community to be back to normal, to be engaged in normal social activities. But to do this, we really need everyone's help. What's going on with COVID right now in the community is significantly straining our healthcare system.
We are no different than any other facility in the state of Kentucky. We are facing staffing challenges amidst rising patient volumes. Many of our staff are quarantined from COVID exposure. Some have retired, some have resigned and left healthcare entirely.
We've seen higher volumes than we've ever seen since the beginning of this pandemic. But this is what's different this time around. We now have a vaccine. We know that while this vaccine is not perfect, it does 4 things, and we've witnessed these 4 things right here at our hospital. We know that this vaccine reduces severity of illness, reduces hospitalizations, reduces ICU admissions, but most importantly, reduces deaths. So we're asking, in fact, we're pleading with every Kentuckian, please get vaccinated. Wear a mask, practice good hand hygiene, practice social distancing. Together, we can wipe out this pandemic.
So as of today, we believe we have at least 21 hospitals across Kentucky with critical staffing shortages. We are continuing to work and hope to have next week a metric on beds, staffed beds versus just beds that have been approved in past filings to show how quickly they are filling up and in regions where there are no beds left. We have identified, and Department of Public Health is able to identify a number of hospital challenges in addition to just being full. Inability to transfer patients due to lack of available beds in other places, including pediatric cases. We have hospitals that don't have pediatric ICU units that are now having to work to try to create them, to try to create the ability to do that. Crisis standards of care. That's something you probably never want to hear in a hospital, that they have to implement, how they're going to triage, what they're going to do, how much staff per bed there is, because when you got this many patients and we're having the staffing issues that we have, all of a sudden there's not one for every X. There's one for every Y, meaning fewer people taking care of more patients. Cancellation of elective and non-emergency procedures. Look, this is how hospital systems make money. And they need to make money, stay open, to expand, to do things. If they are canceling this, it shows that it's that bad. And I'll tell you, our hospital systems have been incredible, that when we reach this stage, they're willing to do this, even though it hits badly at their bottom line, because their calling is to make sure they can take care of as many sick people as possible. Staffing shortages, emergency medical staffing shortages, EMS struggling with 911 runs, and then more people coming into the ER just to get tested. Folks, there are other places to get tested. With the ERs being overrun as they are right now, please find a different testing location. Don't go to that emergency room. There are too many people that are already at that emergency room with significant needs. Further, we continue to see that masking works. It's critical. And we made the absolute right call on universal masking in schools. Let's look at the ABC News clip from Florida. Not currently requiring masking. In fact, doing everything they can to prevent schools from doing it. In one school district, over 10,000 students isolated or quarantined 1 week into school. Meanwhile, what we're seeing in Kentucky, and there was a great story on Scott County, is that when we mask up, we can do this. The kids, they're fine. It's all of us parents that are arguing with each other. They come to school, they are ready, and I can tell you the quarantines and the isolations significantly decrease. Sure, they happen. They're going to happen. What do the kids do when they're outside of school, and how protected are they? But we are seeing the districts that are doing this right and that are working hard and that are taking a good attitude, their students are able to stay in school. And that's why we're going to continue this universal mask requirement to ensure that our kids have as many days in school. And hey, I actually believe that the vast majority of people out there support this. But even if they don't, the right thing to do is the right thing to do, especially by our kids. So I got a text message from a good friend of mine, a physician, just yesterday. And he asked me to pray for his staff, that they are burnout, that they are suffering, that they are frustrated, that they are fatigued. They've already had to hold too many hands of people passing away. And now they're having to do it when just one shot and the follow-up shot, and maybe at some point a booster, would have saved that life. They are trying to be compassionate, and they are trying to have the energy, but I cannot imagine how trying it is for them. You know, there was a time in this pandemic where we lifted up our healthcare heroes for what they are, heroes. We put signs in our yard. We brought them meals. We told them how much we cared about them. And then somehow politics started getting in on all this, and we saw healthcare heroes who show up to give valid scientific testimony at school board meetings or elsewhere, yelled at and bullied, local health departments spray painted. That's wrong. Our healthcare heroes need us right now. Think about what they've been doing these last 17 months. They're tired, they're overworked, and they thought, and we should, be through this by now. We've asked a lot of them. I remember having to stand here and being asked about PPE. What do they need? They need those N95s. They need the KN95s. Are we going to be able to find any? Not in the short term. And knowing that even that afternoon, after I was done, there were going to be people who walked into a COVID wing without the PPE they needed. They did that for us. Now we need to lift them up. Like many of us, they're undoubtedly relieved when that vaccine came. They saw a light, not just at the end of the tunnel of this pandemic, but the trial that they have been going through, that the suffering that they've had to witness, the trauma, because that's the right word, the trauma that they have had to endure. They saw an end to having to hold that hand. And here we are. The job is grueling. The pandemic has been hard on all of us, but now is the time where we all need to collectively, in everything we do, lift up our healthcare professionals. They are heroes. They have earned that title. That's why I'm declaring next week, August 22nd through the 28th, Healthcare Heroes Appreciation Week in Kentucky. And I'm calling on everybody, from our media and media stations to our local restaurants to businesses everywhere. Beginning on Monday of next week, let's lift these amazing people up. Let's try to give them new energy. Let's show our appreciation. If you're a family member of one, maybe wake up a little early and prepare breakfast and give a few more hugs. If you're in the media, let's think about the types of stories of bravery and courage that we continue to see every day, and the thanks that we have for these individuals. If you're a local restaurant, what can we do to provide a great meal? Or a local retail outlet, what can we do to show our appreciation? These are amazing people. Doctors, nurses, hospital and clinic staff, EMTs, ambulance drivers, custodians, just to name a few, everybody who is working in those buildings. So folks, because of this Delta variant, they're going to be at this a little longer, and they need our help to have the fuel to get through. Given they are there and they are helping out our family members, our people, working on saving lives, and probably doing so at a better rate than we have ever seen in a pandemic in human history. Let's make sure we're there for them. So this next week, come on, let's blow it out. Let's make sure that everywhere these healthcare heroes go, they see how much we care. And if you put away those green lights, it's probably time to get them back out again. We're going to go through a tough time where we're going to see more loss. We're going to have more wearied healthcare heroes going home later at night. Let's make sure they can see our compassion and that it's going to continue and it's going to extend as long as it has to. Let's support these folks. Healthcare Heroes Appreciation Week. This shouldn't just be something on a proclamation. This ought to be something that all of us as Kentuckians put a ton of effort into. And 4, Healthcare Heroes Appreciation Week. What's the number one thing you can do to show your gratitude? Get vaccinated. And we are continuing to see a small uptick in vaccinations. Between yesterday and today, about 6,935 new individuals getting their shot of hope. Now 2,436,044. We've had a second county, Franklin County, go over 70% of its population that has had at least one shot of hope. The other is Woodford County, with Fayette sitting at 67%. But remember, getting vaccinated is a great way to show your gratitude. It's also a great way to save your own life and to protect the people around you. This variant is different. It's attacking younger and younger Kentuckians, and in many cases, it's making them much sicker than the original COVID strain. And while I've been saying that, Dr. Stack's been saying that, healthcare providers have been saying that, sometimes I think we need to hear from somebody who's been through it. That's why some Kentuckians, like Ethan, who you're about to hear from, are sharing their stories to encourage people to make the choice that could save their lives.
I was very, very big on anti-COVID, anti-vaccine. I made Facebook posts, public posts, talked to people, made a big deal about it, made a point to not wear a mask, made a point to say that COVID wasn't important. And I am eating crow on it because I experienced it. I laid in a hospital bed for 2 separate occasions in the last month. I laid on the bed in so much pain that my wife, who is a nurse at Baptist, and her coworkers were just trying to calm me down from how much pain I was in. And fighting for breath, that was when I realized this is really bad right now. I can't even tough it out, you know? I think of myself as a guy that can handle some stuff, and I'm laying on a hospital bed and I can't even sit still. And the doctors up there did above and beyond what they could have done and saved my life. Having COVID, I wouldn't wish it on anybody. It's because of COVID I have to fight now every day to get a little bit better. I'm relearning how to walk without catching my breath. If I knew that a vaccination would have taken 75% or even half of my struggles the last month out 6 months ago, I would have got it in a heartbeat. And I would have never looked back.
I want to thank Ethan for being brave, for being willing to admit when we're wrong, and for also showing the dangers of misinformation. One of the most difficult things that we face in our fight against this virus is folks either putting out information that is blatantly false or sometimes intentionally lying. And we've tried to talk in different times about what those are. Sometimes it's putting something out that is just untrue, like the people that say masks don't work. They do. Study after study after study show that they do. Sometimes it's folks writing an op-ed who want to say what the WHO recommends and never what the CDC has recommended right here in the United States. But it's been hard to find a visualization of what people can do blatantly lying on the internet with the intent to confuse you about what's real or what's not, about whether we should really follow these things. Until it happened to me today, this morning. So this morning I went to a commodities breakfast at the Kentucky State Fair. It was outside. It was under a tent open on all 4 sides. There were no fewer than 4 media stations there. And based on our guidance, that's an event that we believe is safe to not be wearing a mask. And we got this Facebook photo that we'll put up in a minute that people started putting out saying the governor doesn't really believe in masks because he is indoors not wearing one. Folks, this is the event. You could take and you can crop a photo to show whatever you want. But I wanted to make sure that you all could see that there are intentional lies, not just misinformation that are out there. And if you're spreading these, you're intentionally confusing people, but more than that, you're lying to them. You know, my faith certainly teaches me that lying is wrong, and certainly lying in a way that could harm people is wrong. So this was the post that was put up, and that folks are trying to push around. As you could see, there's a governor indoor without wearing a mask. He doesn't believe in it. You don't need to wear one. That's the exact type of misleading types of lies that mean to confuse some people who, oh, you don't really want to wear one and you're trying to figure out whether you need to. Go back to the other pictures. Again, when you're not doing the manipulation and you can see the truth, listen, this doesn't upset me. It doesn't bother me. But what it is a clear example that you can see of those that would intentionally distort and ultimately lie. So don't get your information from COVID on Facebook. Facebook is not a doctor. Dr. Stack is a doctor. Your local pediatrician for your kids is a doctor. Or talk to a nurse. Talk to a nurse at your school. They'll tell you kids should be wearing masks. Talk to a nurse in your community. They'll tell you that you should get vaccinated. But remember, when you are online, whether the people are in this country or outside of it, they are trying to tear us apart and tear us down, and they will use misinformation. But I mean, calling a lie misinformation, you know, that kind of softens it. Make sure that you're getting your news from a credible source. But I was at the state fair. We're excited the state fair is back and that we can do it because of vaccinations plus masks. And while every booth is important in the state fair every year, one is more important than any other. That is because we are offering free vaccines at the state fair. The Cabinet for Health and Family Services is offering them every single day, August 19th through the 28th from noon until 6 p.m. All of our healthcare organizations in the area are helping out: U of L Health, Norton, and Baptist Health. And if you come and you get your shot of hope, you do not have to have any RSVP. You can just show up. You'll get a $30 all-you-can-ride wristband for amusement rides, $20 gift card that can be spent on food or other items, both provided by WellCare of Kentucky. The wristband and gift card will be given to each person who gets vaccinated. So let's say you're a family of four. I'm a part of a family of four. That's $120 in all-you-can-ride wristbands and $80 in gift cards. While you're there, you can also sign up for all of the potential giveaways from the tourism cabinet that we talked about the other day. And if you get on your phone, you can sign up for your shot of hope. If you're an adult, win $1 million. If you're under 18, you could win a free ride to a 4-year, 2-year university. You can win books, tuition, and room and board. So please get vaccinated. All right, let's just briefly look at some of the COVID charts and numbers that we look at. We did this just a couple days ago. When we look at our stair-stepper chart, our climb is rapid, and it is concerning. And at this rate, we are going to be out of hospital capacity very, very soon. We've probably moved from alarming to critical already, but certainly we are rapidly approaching entirely full. COVID cases by week. It's not just that they are increasing. It is the amount that they're increasing is speeding up, not slowing down. We right now have the highest positivity rate of any time in this pandemic since we've had enough testing for people to come in and get tested. Again, one of the most dangerous times that we can imagine. We're now over 12.45%. And it's taking the lives of younger people. We tried to put together just a couple pie charts to show you how much this is changing. So from March to May of 2021, 94% of people that we lost were over the age of 50. And this is just 50. 50 isn't old. God, I hope 50 isn't old. Look, from June to August, where we are right now. The amount of individuals under 50 that are passing away as a percentage of everybody has more than doubled, and it is increasing. Folks, I think it was just yesterday I read off almost half of everybody that passed away was below the age of 50. Well, 3 days ago, I think at least 2 of them were in their 30s. So please be very, very careful. One piece of good news as we fight this battle is that we are going to continue to have the full aid and support of our National Guard. They have done so much. They've worked with our vaccination teams, helping thousands of Kentuckians get their shot of hope. They've helped at food pantries and staffed our medical facilities, making sure everybody is healthy. This morning, we got word that the Kentucky National Guard received federal approval to continue supporting our pandemic response thanks to federal funding that will continue through the end of the calendar year. So next week, you're going to hear about some additional steps that the National Guard is going to be helping us with so that we can boost our healthcare capacity across the state. And we took one step yesterday to do just that. And that was a new order that's gone in that's going to allow people that are licensed in other states that have earned whatever that credential is to be a doctor, a nurse, etc., to be able to practice on an emergency basis here. It's going to allow some additional help. It's going to allow people to cross a river to potentially get care. That's one small step. We're going to need to take many more large ones. I'm going to now turn it over to Dr. Stack. He's going to finish up on our COVID portion. And then we're going to have a few positive jobs and training announcements. And at that point, we will open it up to questions. Dr. Stack.
Thank you, Governor. Good afternoon, everyone. I owed a follow-up from the last press conference. I said that influenza data showed that masks worked right here in Kentucky. So for the influenza season right before and at the very beginning of the COVID pandemic, 2019 to 2020, Kentucky had 27,408 confirmed influenza cases. And for the entire season before COVID, we had 165 influenza deaths. For 2020 to 2021, so the winter we have just concluded, when COVID was in its huge surge, we only had 186 confirmed influenza cases. So that's 27,408 the year before compared to 186 for the most recent year. We only had 2 known deaths from influenza last year. So the masks work, folks. I mean, there's a lot of other evidence too. This is just one data point. The problem is COVID is just more contagious and is an even more difficult infection. Can you show the one healthcare capacity slide with it? Thank you. This is my only image for today. COVID-19 ICU patients set a new all-time high yesterday for the entire pandemic. The governor's already shown some videos, testimonials from people who are actually at these hospitals. We're getting increasing numbers of facilities report severe strain and report that they are having to consider or are already implementing crisis-type levels of staffing and care changes. This means that folks, not just with COVID, but all folks who need help at the hospitals, whether that's for illness or injury, COVID or non-COVID, will start to see probably a deterioration of some of the care they get because they won't have the same amount of staff to provide care. This will impact everyone needing care, not just people with COVID. I need to ask you to be patient with these folks. I want to put this in context, particularly if you're going to the hospital for COVID care and you have chosen not to be vaccinated. You will be going to exhausted healthcare providers who are understaffed and providing care for you for a disease that was preventable largely because of the vaccinations. You need to be very patient with those folks. Because they are in a difficult situation with the distress that comes with providing care for large numbers of people, overwhelming healthcare capacity, seemingly because they were unwilling to get vaccinated. Please be patient and grateful for what they do, even if it doesn't happen in the timeliness and in the way you think you are entitled to. All of this is happening in the context of some members of society telling people to disregard public health guidance to get vaccinated, to wear masks, and to take other precautions. This creates division, confusion, and will cause not only loss of life, but also deep harms to the healthcare system that will not easily be repaired. Humpty Dumpty is falling off a 30-story building, and there is no parachute and there's no safety net. We're entering a time when people with and without COVID are going to get seriously hurt and may well die. So I have some specific action steps for you. If you have an emergency, go to the hospital and seek care. You shouldn't delay your care if you have an emergency. If, though, you do not have an emergency and you don't need to be at the hospital, I strongly advise you to not go to the hospital. And I do have confidence, just like the governor does, in our healthcare system and in our hospitals and in the clinicians that work there. But let me tell you, if you do not have to be in the hospital overnight for a stay, if you have a procedure or a surgery scheduled that you have to stay overnight in the hospital afterwards, and it can be safely postponed for a little time, if you were my family member, I would tell you to not go into a hospital now if you could avoid it. This is not the time to go in there because the experience may not be the same. So please consider that carefully. And finally, the governor's already touched on this. Do not go to an ER just to get a COVID test, period. Do not go to an ER just to get a COVID test. If you are sick, if you think you have an emergency, go to an ER. Do not go to an ER just to get a COVID test. Those folks are focusing in horrible conditions on trying to take care of really sick and injured people. And what will happen, and they can't say this, federal law requires that they evaluate you and provide care, but what they will do is triage you. You will sit in a waiting room for a very long time. And if you leave, you may well get a bill still for the triage, and you should, because a nurse and a qualified medical team had to evaluate you at the front end. If you need a test, go to a pharmacy, go some other location where you can get a test, but do not use the emergency department just for COVID testing. I'm going to talk about the COVID vaccine. Oh, one other thing about the health departments. The health departments are still actively monitoring the disease. They are actively advising and supporting persons and businesses and schools in their communities, but the public should not expect a phone call from a health department to confirm that you have a positive COVID test. You should not expect a phone call from the health department to talk to you specifically just about quarantine and things of that nature. If you're exposed, you should stay away from others. Quarantine is still useful. If you have a positive test or you have symptoms, do not go to work. Do not go to school. If you are sick, you should stay home until you are better, because people who are sick should not be out there spreading disease right now when I've just described the horrible situations unfolding in hospitals and, as the governor has shared, that are impacting younger people. But please, it is not the same as it was before. You're not going to be getting phone calls for every single positive test, and the public has to adjust its expectation of that, because the public health workforce is strained in its own way, just like the acute care clinical workforce. Now, with respect to the booster doses and third doses, they're not the same. Right now, the only persons eligible for a third dose of an mRNA vaccine, that's Pfizer or Moderna, are individuals with moderate to severe immunocompromised conditions. And we gave a list before on a slide. That information is now widely available. If you are one of those persons, you can go to a pharmacy, you can go to a health department if they're offering this, you can go to a clinic, you can get your third dose. Let me be very clear about this. Don't lie about this. They query the registry and they know how many doses you've had. And if you don't qualify for the indications, they won't give you that third dose generally, because they have to follow the emergency use authorization criteria, which specifically says the third dose is only allowed for people with immunocompromised conditions. Now, if you live in a nursing home, if you are a long-term care facility resident, I have written a letter and declared and deemed that all residents, all permanent residents of a long-term care nursing facility, a skilled nursing facility, are determined in Kentucky and deemed to have moderately to severe the compromised immune systems by virtue of the medical conditions that put them there, the frailty they generally have, and the high mortality rate that was experienced for much of the COVID pandemic. And that letter is being shared and is available, so pharmacies should feel free and should offer to all of those individuals who are inpatients or residents of a nursing home to give them that third dose. Now, the White House announced yesterday that it was going to proceed with trying to make available a third dose of mRNA vaccine to persons the week of September 20th. I want to just, there's the devil's in the details in this. That's September 20th. It's not now. That's 1 month from now. And it will be for people who have had their second dose 8 months or more before, which means not everybody's eligible. You have to have had 2 doses of Pfizer or Moderna, wait 8 months or more, and then you may be eligible for that 3rd dose. The FDA and the CDC's Advisory Committee on Immunization Practices still have to review the data and make the necessary changes to make that happen. I am confident it is likely to happen, but we're talking a month from now. So please do not go and seek your 3rd dose yet. You're not eligible. And when it is time, sometime in September, you have to have had 8 months pass. At least that's the guidance they've told us so far. My final thoughts here, for those of you who have listened and tried to do your very best to comply with the guidance we've given throughout the pandemic, thank you. You too are heroes. Your actions have kept you safer, kept others safer, and have really helped all of us and been an inspiration to others. I think you are heroes in your own right for taking these difficult steps to comply with these requirements and requests, which are clearly not the lives we used to know. For all of us, because society is succumbing to a sea of disinformation and persons in positions of influence are misleading the public, a tiny little virus is winning. The virus has been smarter than humanity. We could have snuffed this thing out, but instead it is snuffing us out, and we are tearing ourselves apart, arguing over things that should not be divisive. This too shall pass, but it will not go silently into the night. A lot of people are going to get hurt. I urge all of us to try, however hard it may be, to strive to be kind, caring, and considerate to each other. And for anyone willing to listen, please get vaccinated, wear a mask whenever you're near others, and take steps to keep yourself safe. Though we can't control the action of others, there are many steps we can take to keep ourselves and those we hold dear safe from the worst harms of this devilish virus that is causing so much harm. Thank you very much.
I think we can see the strain on all of our healthcare providers, and I sometimes forget that includes our own Department of Public Health. We all want victory in this. We all want to protect those around us. Let's make sure we get it done. Now, while we are battling this very difficult virus, we are continuing to see positive economic news. And what that means is what we're fighting for are not only our lives and our health, education of our kids, but also the real potential in front of us that this state economically can be something that we all dreamed of. And that's happening right now. Our ability to defeat this virus directly related to what our future potential is and whether or not we ever have a ceiling anymore, about whether we can ensure that we are never a flyover state ever again. So I want to continue to highlight our economic progress because it's just another reason that we got to do the right thing. We've got a world-class workforce here in Kentucky. To keep our economy growing the way it is now, it's crucial we continue to facilitate these skills training opportunities for Kentuckians across the Commonwealth. These types of initiatives, they help our residents improve their career outlook while ensuring our companies have the skilled workforce they need to grow and to thrive in our state. That's why I'm pleased to announce that throughout fiscal year 2021, our state approved funding that will power skills training for nearly 18,300 Kentucky workers through the Bluegrass State Skills Corporation, or BSSC. Attached to the Kentucky Cabinet for Economic Development, this group helps private sector businesses establish industry-specific training programs. This past fiscal year, the BSSC Board of Directors approved roughly $6.1 million in funds and credits for 111 Kentucky facilities, those are different businesses, to train 18,000 plus workers. Earlier this month, we built on this momentum as the board approved another $1.8 million to support nearly 4,200 additional trainees across 19 additional facilities. These programs help to establish employer-driven training initiatives that benefit thousands of Kentuckians across a range of industries. These types of operations, the types of operations that can qualify for these incentives include manufacturing, agribusiness, non-retail service or technology, and headquarter operations, plus several others. Kentucky's workforce, our people, that is the backbone of our economy. And we got to continue doing everything we can to preserve this incredible opportunity in front of us. So, in talking about the economy, we also have yet another win for Team Kentucky, another new jobs announcement. Eddie Kane Steel Products, a distributor and processor of steel plate, plans to create 25 new high-paying jobs for Kentucky residents across the coming years with the construction of a $4.8 million steel processing facility in Brandenburg. Carrying an average hourly wage of $33 an hour, including benefits, these jobs are going to make a huge difference in the lives of these Kentucky families and their communities. Eddie Kane Steel, this is as Eddie Kane Steel's first Kentucky operation. That's exciting. We like people to expand. We also like getting new folks in. This new facility will serve as a critical regional hub for the New Jersey-based company. Operations at the Meade County plant will include distribution and processing of carbon and alloy steel plate. This company clearly recognizes Kentucky as a terrific place to do business with the right workforce and distribution advantages, logistics advantages you can't find anywhere else in this country. In this instance, the state's growing manufacturing industry and its host of logistical advantages played a, if not the, key role in bringing Eddie Kane Steel to the Bluegrass. In addition to providing Kentuckians with high-quality opportunities, I'm happy to say the company has a simple, powerful mission statement that we can all support. It's the golden rule. Treat others as we would like to be treated. So today, Eddie Kane Steel just doesn't give us hope for the future. They give us the secret to how to win in the present. Care about one another, love one another, sacrifice for one another. Just do what's right. This morning, I also wanted to ensure the people of Nicholas County that they know that we submitted the request to President Joe Biden to fund individual assistance to those eligible in Nicholas County who were impacted by the 1 in 1,000-year flood that occurred July 29th and July 30th, 2021, and to declare a major disaster declaration. We are not able to do this until we get sufficient information in, until FEMA has already been on the ground. We believe this process has gone as fast as I think we've ever seen here in Kentucky. Kentuckians in Nicholas County worked so hard to support each other during a tough time. I was there personally, saw homes that had been pulled off their foundation, had a red X spray painted on them and a notice that they were condemned and could not be reoccupied. I cannot imagine how that has to feel to each one of those families. If we are successful in getting individual and household assistance, the maximum funding for home repair and restoration is $36,000 for each household, and an additional $36,000 is available for the necessary expenses and serious needs directly caused by the disaster. This flooding impacted 88 homes, but it did more than impact them. I mean, this flood tore through those homes. It also impacted the city's wastewater treatment plant, fire station, city garage, and 29 businesses. Now, on that public side, meaning governmental side, we do believe we will have challenges because it is so localized in whether or not it's going to reach the necessary amount of damage to get the order on that side. We certainly hope, and we will push on the individual assistance, which we think absolutely should qualify, and that the federal government was very generous on in other recent flooding events in eastern Kentucky. All right, before we open it up to questions, we have a Team Kentucky All-Star today that we need to recognize. While we have seen some arguments over masking in schools, and again, those that are relieved don't always show up to tell people about it. We've seen some people just get to work, trying to do the right thing to help students have the best experience they can. So I want to thank parents at Clark Elementary School in Paducah who donated 18 picnic tables to the school so students could eat lunch and even have some classes outside, something that's good for them and reduces the possibility of transmission for COVID. They found a way, right? They found a way to make things safer for those students, which is very, very special. We appreciate their innovation and how much they care. And finally, once again, we have a least valuable Team Kentucky player. And I don't know how this happened, but I got a call this morning that this dog got skunked for the second time in the last 2 weeks. Thankfully, my wife is much smarter than I am, dealt with it much better, and I am told that when I return home, I will be able to habit the building. So we do love her. She's very sweet. And that's all I have to say positive about Winnie at the moment. So again, I know it's a serious day and we've got serious questions to follow up, but never bad to get a bit of a laugh. And again, I guess being governor and first lady is real glamorous when you're washing the skunk off your dog twice in that period of time. So we have 3 journalists that are in person today. We have others that are on the phone. We're going to get through everybody because we appreciate everybody trying to do this safely. So we'll start with Carolina.
Yesterday's COVID report, we saw nearly 1,000 cases in children. Are you concerned by the amount of cases we are seeing in children? And, you know, a lot of them cannot receive the vaccine yet. A lot of them are back in school. What are your thoughts on it?
It's the right question. The Delta variant is hitting younger and younger people. Part of that is because older individuals are vaccinated and they are better protected from it. But with the most aggressive variant out there, the only people who aren't eligible to get that vaccine are our kids under 12. That include my daughter. We are very concerned about it. But we do believe that with a mixture for the kids that are old enough of vaccinations plus universal maskings in school, that we can and should have in-person learning. And we have already seen the level and amount of quarantines that you have to do when everybody is universally masked is much smaller. But I do think it means people need to take extra precaution with their kids, especially those that are unvaccinated. Remember, if your kids are wearing a mask in school when they're inside with other kids all day, they're protected. But if you bring them home and have 6 or 7 other kids come over and they're not wearing a mask indoors, we undo a lot of that effort. So what I'd ask is that parents be careful with your kids. I know you love and you care about them. This is infecting more, and it is putting more and younger kids in the ER and in the emergency room. And shame on anybody who says, well, wait a minute, there are only 18 kids in pediatric ICU. That's the record we've seen. And there are only a couple hospitals that have a pediatric ICU. Everybody in a normal ICU that's a kid isn't counted in that number. Highest ever and growing is a very, very big concern. Tom.
Thank you, Governor. I participated in a Zoom press conference this morning with hospitals in Lexington, St. Joe's, UK, and Baptist Health. They pretty much echoed what you presented here this afternoon. So my question is, you talked about everything being on the table when it comes to restrictions or bans or what have you. As this appears to be getting worse and worse, what will be your trigger and what can we expect to see?
Well, again, we have to recognize that this variant is spreading quickly, but we also have to recognize we live in a different world where we have vaccines and we know the power and efficacy of masking. A statewide mask mandate is something that we have to be actively considering. Certainly, if we reach a point where there are no beds in the Commonwealth, we're going to have to take some strong steps to make sure that we can reduce the number of people that would be going to the hospital with COVID, not just for them, but for everybody else that could be harmed. So we're watching the numbers very closely, and it's certainly right now healthcare capacity that's at the top of my mind. But that's not the only thing. There are folks that don't end up having to be fully hospitalized, but deal with healthcare issues from this far into the future. And this is personal for me. I have an aunt that in the hospital had to have surgery because of a bad fall. And we're that close to her not being able to get what she needs. And that could have been it's already very serious, but it could have been much, much worse. Phil.
Governor, you talked about the state fair and and it's an outdoor event, a lot of outdoor events with the state fair.
Mhm.
High school football games are going to be starting tomorrow night. Is there new guidance as far as being close to one another without a mask on? Is there anything new about that, or what's the latest with that?
So we think that outdoors is certainly much, much safer than indoors. And I will tell you, for the events I'm doing right now, I'm trying to push all of them outside. It's really hot. I may look really sweaty, but it's the right thing to do that keeps people safe. I just ask people to be smart. Listen, you know what this virus can do. We know how it spreads, and it's spreading a lot faster. Don't get in really big groups packed together. Spread out some. Now, sit with your family unit. You can go say hi to people. That's no problem at all. But let's not all rush the field in a big mob, first, because that causes damage that the high school had to pay for. And second, that it, again, makes it less safe. We're seeing some spread on sports teams, high school teams, and it could be that they're engaging in indoor activities, or could be that they're getting together at other times. But also, you know, the more really close contact for a prolonged period of time that you have, the more at risk you are. Certainly outside is a ton better. So for those football games right now, we're not making any type of capacity suggestion, but be safe, spread out. There's a lot of bleachers. Just do the right thing. All right. I think it's Brea Jones from WFPL.
It's Brea. And when will we be able to see, when we start to get the data in about the capacity at hospitals, will that be included on the dashboard or the daily reports, or is that just something that we'll get updates on during like the Team Kentucky updates?
Well, our hope is to give an update on that weekly once we're able to. The challenge is it bounces up and down even on a daily basis. I mean, sadly, when we see one day to another that we have 4 less people on a ventilator, we don't know if that's a good thing or a bad thing for several days, and whether they made it off and are recovering or didn't make it. And our challenge is the staffing levels go up and down too in hospitals. And we hope that we can try to add, but they can lose people. So the loss of 2 or 3 staff members that can't be replaced may change the number of staffed beds. What I'd ask is, don't just look at an overall number of beds that have been approved through the process, because right now no hospital can staff all the beds they have there. And the more intensive the care is that's needed, the more staffing that's needed there. So our hope is to have something useful at the beginning of next week. But this is a new type of tool we've got to build to make it accurate, and not just to list, you know, overall numbers of beds. So we hope first to build it and then to improve it. There are going to be flaws in the data, like there always are up front, but we think we can get it better and better as we move forward. And we really need buy-in, and I think we have it from most all of our hospital systems. People need to know and to be able to look at something, even if it's a couple days old, about where they might be able to get in and where they might not. Al Cross, Kentucky Health News.
Thank you, Governor. We live in the same neighborhood, you know, and I smelled that skunk last night. I've had to wash my dog off too. Not lately, but maybe we can get animal control to do something with the big skunk nest we have in South Frankfort.
I'm for it.
My question to you is, there was a reference by Dr. Stack, and he might want to answer this, to people in public office who are misleading people. And there was a big story by Morgan Watkins in the Courier this morning about what Senator Paul and Congressman Massey are saying on Twitter. Is that who you all are talking about?
Well, I can't reference who Dr. Stack was talking about, but I believe those 2 individuals are misleading people on Twitter. I mean, you can't say masks don't work. They do. You can't push people not to get vaccines when they're saving lives. You can't tell people that they don't need to get vaccinated because they've already had COVID, when the research from Kentucky shows the opposite. Listen, this isn't playing politics. I think Mitch McConnell's doing the right thing. All I'm asking people to do is the right thing. And I will say, Al, that there's also a responsibility, and it shouldn't be one where I or anybody else has to ask of any public official right now when they have a microphone to push for people to get vaccinated. And we just don't see enough of that. But I did, in the last couple days, see some real courage. We were at the Pike County Courthouse, and Ray Jones, county judge, not only got up and begged people to get vaccinated, he looked at everybody in that courthouse and the cameras and said universal masking in schools is necessary. That takes some guts. Then we saw John Blanton get up and Philip Wheeler get up and tell people that the virus was real and that they needed to get vaccinated. And you know what? It was nice. There's no politics. It was just people trying to do the right thing. So I get that Rand Paul doesn't want to be like me, but how about being a little more like John Blanton or Philip Wheeler? Debbie Yetter from the Courier-Journal.
Hi, Governor. As I'm sure you know, the president yesterday directed CMS to work up guidelines so that nursing home staff will have to be vaccinated if they want to continue to receive Medicare or Medicaid funding. Do you have any thoughts about that, or whether that kind of mandate should be extended to other providers that get federal money for healthcare?
Well, we saw that news. Certainly we'll look at the guidance when it comes out. None of these facilities can survive without Medicare or Medicaid. And certainly I believe that everyone in these facilities needs to be vaccinated, because if they are unvaccinated, the chances that they are bringing in this deadly virus to the facility are so much higher. And then they're exposing people who are so much more fragile. So I believe that there is a responsibility to the people that the individuals who work in our nursing homes serve to get vaccinated. Now, I do recognize that staffing is hard to find and that these facilities are worried about whether they can have sufficient staffing. So we're going to have to look at both those issues as they come. But listen, if this is what the federal government says is required to get the funding, then every single facility that receives that funding is going to have to do it. It shouldn't take that, should it? It shouldn't. But we still have a large portion of people who are protecting or who are providing services to our most vulnerable that aren't protected for them. And that's not just that area. And we need to do better with our corrections officers. We need to see more law enforcement vaccinated. Across state government, we need to do better too. But this is certainly a step that if the federal government takes, I do think will result in more people getting vaccinated. Josh James, WKY.
Hi, Governor. This might be a question for you or Dr. Stack. I want to take the long view on this for a sec. I read an interview with a Harvard epidemiologist who said that basically, given the vaccination situation, we're looking at an ongoing pattern of ups and downs in cases, even potentially for another year or two until we get more folks immune and the virus runs out of tricks mutation-wise, I guess. My question is, how should people think about the future and plan long-term, given that we're seeing this pattern repeat itself?
Well, I'll let Dr. Stack respond too if he wants, but projections don't work. And honestly, we don't know. This is a new virus, a new pandemic, and certainly earlier projections on what would happen and how long it would last weren't accurate. I think the answer is we got to do what we got to do. This is coming to kill as many of us as possible. And so we've got to adjust. I see folks playing politics, trying to criticize that the guidance changes. Should you wear a mask or should you not wear a mask when the virus has changed? So we've got to start by respecting the fact that this thing is deadly, it mutates, and it's coming for as many of us as possible. Now, I'll give you a personal opinion. I think that we will see at some point the end of this, at least in the deadly form we do. The question is how we get there. Either we get as many people vaccinated as we can and get there, and we get there with less casualties. Or at some point we get a variant, maybe it's this one, maybe it's the next one, that is so aggressive it burns through our population at such a rate with even more devastating consequences. I think that we've got to choose that first route and get more folks vaccinated.
Yeah, so I would like to comment a little bit additionally. So we do try to prognosticate or plan to some extent because we're trying to anticipate what we need to do to make things better. But we have plenty of examples in history for what happens. We eradicated smallpox. We eliminated smallpox in the human population through vaccination. Smallpox kills 30% of the people who get it. Think about that. COVID has a 1% to 2% mortality rate. Nationwide, it's about 1.7%. It's about 1.4% in Kentucky. Imagine if COVID killed 30% of the people it infected. Okay, so bad can get much worse. Measles, one person infects 15 other people on average. One person infects 15 other people. We have essentially eliminated measles, except for places where people don't get vaccinated. And then you have little measles outbreaks. Polio paralyzed people. Franklin Delano Roosevelt is thought to have been a victim of polio. Kids were paralyzed or died from polio in the early parts of the last century and well into the middle part of the last century. Guess what? How many people do you know who have had polio? You don't, because vaccination eliminated it. So there is a very clear plan here. We've got great vaccines that already blunt the worst harms of this disease. People need to get vaccinated. And if they don't, then hopefully the vaccinologists, the immunologists will continue to make better vaccines over time. And the folks who choose to get protected will get protected. The virus will continue to mutate. It doesn't run out of tricks, ever. As long as it's propagating, it will continue to find new tricks. And what will happen is, like the governor said, if it gets smart enough, then the people who choose not to get vaccinated will get wiped out. And let's hope it doesn't get there, because no one wishes ill on anyone, even if we disagree about the value of vaccination. But we have plenty of diseases throughout history where we have proven that vaccination can eliminate and prevent these harms entirely or almost entirely. That's what we need to do with COVID, because it's not just going to disappear on its own. Smallpox, polio, and measles never just disappeared on their own. It took science and immunizations to get rid of them.
And for so many things, those vaccines are required here in the United States, whether it's to go to school or other things. Stu Johnson, WKU.
Yes, Governor, thank you. You mentioned today that there were, I believe the figure was just over 6,900 new vaccinations yesterday to today. Looking back at my notes from last week, it looked like it was just over 8,600 new vaccinations from day to day for the period last week, that one day to one day. So are vaccinations declining? And if they are, or even if they're not, do you see a point for mandatory vaccinations more so in the public and private sectors?
So the vaccines, if we go back, 4 weeks probably, are certainly up. The amount they're up may have generally stabilized. I do believe if we look at the 4 weeks beginning the week July 5th through August 1st, that we're in the last week of the subsequent month, that we are going to be at or maybe slightly above what we saw. So, for instance, if we go back 2 months ago, we were at about 109,000 during that period. Then we went to about 122,000. I think we will be, for the 4 weeks following the 122,000, right about the same. Certainly, we just saw news from Humana that they are going to require certain folks in certain positions to get vaccinated. And I also think that when we have full FDA authorization, that there are a slew of companies out there that are going to require it. I think we will see it in the private sector, looks like in the military, and in some other areas, in the very least, first. Let's see. Next, we have Kimberly Keegi from WSAZ.
Hi, everyone. Thanks for taking our questions today. This is a question directed for Dr. Stack, and hopefully he can give us some more information. He mentioned writing a letter to pharmacies to allow nursing home residents in long-term care centers to be considered immunocompromised and be eligible for that third dose of the vaccine. Can you give us some more information as to when, if this has been approved? And is it something that families of those loved ones need to kind of be proactive about and say, I'm interested in having my loved one receive their third dose? Thank you.
Sure. Thank you for the question. So the letter is publicly available, and we can, if you just get with the communications office, we'll make sure you get a copy of it. The second thing is we are informing through the associations and through the pharmacies who support the associations that we're giving them that letter and letting them know that it is the Kentucky Department for Public Health's active request that they offer every resident in a nursing home access to the vaccine. So one, it should happen without them having to ask, but if they need to ask, we'll make that letter available to you and you can publish it and we can share it widely. Essentially what I've done is I have deemed as the health commissioner for the state health official for the Commonwealth of Kentucky that those individuals residing in a nursing home qualify as being at least moderately or severely immunocompromised and are therefore eligible under the current FDA emergency use authorization. So we hope that helps and gets everyone access quickly.
And I just add the logistics are going to be different this time for that booster than they were the first time. Remember, we did nursing home patients first, along with the healthcare heroes. And at that time, these vaccines weren't everywhere. They weren't anywhere. They were just at a few providers. Now they're at every pharmacy, every drugstore. So the individual nursing home can and should contact any one of those providers that already have enough doses in virtually every place to do most of this and can order the rest within a week. This lets them get it done in their community. This lets it get it done on their schedule. But anybody who is worried should first call the facility that their loved one is in and ask them for the schedule. And if the facility doesn't have one, as long as you can, take your loved one out. You can take them to any place that is providing COVID vaccines, sign up and get that booster. So again, it's just very different. And we now have vaccines on every street corner. And so the ability of each group to schedule it is different. Joe Ragusa.
Hi, Governor. So given what we kind of opened the press conference with, I feel like I already kind of know your answer to this question, but I'm going to ask it anyways. So when I look on social media and see the discussion about where we're at with COVID and everything, I see dozens, hundreds of people bringing up KHA numbers showing that there are still hundreds of hospital beds and ICU beds available in the state. What do you tell people who use that as a reasoning for not taking this seriously?
Well, why don't you ask a nurse, a doctor, custodian working in your local facility? We've already shown you people weary, upset that they don't have the means to provide additional help. And again, a bed without a medical professional is just a bed. That is not treatment. Listen, we want everybody to be okay. And listen to your friends that haven't been able to get in for something else that's out there. I mean, the truth is the truth. And you can look at any graph or anything else and try to use it in a way that's not. But our hospitals are absolutely filling up. And that person who wants to argue that COVID isn't serious and isn't real, I really hope doesn't need that bed, because for other people, it's not going to be there. But that's the problem with this Facebook misinformation. You'll have somebody who says, I can't get my sister, my mom, into a place, and they'll argue with them. You can't argue with somebody who can't get their relative in a bed because it's not there, and tell them, no, the beds are there. The hospital's not turning you away because it wants to. But again, there's those that are exposed to misinformation, and then there are those who are just online using whatever they can to lie to other people. And that kills people. You don't think this is serious, we'll all know somebody in short order in the hospital or in the ICU. Please get vaccinated. Please don't get your news off Facebook or social media. if you're in that cycle, please turn it off. Listen to Ethan, by God, and everything he's went through, and his courage to tell you the right thing. And don't argue with him, and don't try to bully him. He's doing the right thing. I hope you will too. I think we got somebody on from WLKY. Okay. Then we have just a couple of written questions, and then I know everybody's been here a long time. Aaron Mudd from the Bowling Green Daily News. A local school district here in Warren County is seeing hundreds of students in quarantine after starting the school year without universal masking. That's right. That happened. And that's why we have to have universal masking. Despite that, it's not publicly reported that information through its COVID data dashboard. There is a duty to do that. Come on, you got a lot of scared parents. Why? Because you have a lot of COVID. And if you have a lot of COVID in your school, please be transparent. Will we require school districts to be transparent and consistent in how they report COVID-19 cases and quarantines? If we have school districts that aren't doing the right thing and that aren't being upfront and transparent with their parents, then yes, we'll have to take steps that we don't want to take. But listen, if a school district's already been in the wrong once, and now I think it's over 1,000 students quarantined, why be in the wrong again? Just do the right thing. Realize how serious this is. The COVID isn't different there than anywhere else. Come on, do the right thing. Olivia Krauth, given the COVID-19 cases are continuing to escalate and a few school districts have needed to close already, are we considering issuing an executive order calling a special session to give districts more flexibility regarding NTI? Yeah. It was real smart of the legislature to limit MTI, but cases were on the decline at that point. Now, depending ultimately on executive authority, there may be an ability to do that without a special session. Can you imagine having to spend $600,000 of taxpayer money to bring people in to say, yes, COVID was real and we will need more NTI? But I'm worried that some people who would come to Frankfurt would be unmasked up there saying it isn't real and our kids ought to be unmasked. Oh, wait, a committee just did that. Folks, we got to take this seriously. It's certainly taking us seriously. Scott Brown, WKDZ Radio. There is no known booster shot for those people who received a J&J vaccine. That is absolutely correct. What advice can we give them? You need to sit tight until we learn more and until J&J has more information. We do not know. And right now you should not get a Pfizer or a Moderna shot as a booster for J&J. That has not been studied. If we get different advice on that, we will get it to you. There also aren't really good studies on how long your immunity lasts with J&J like there are on Moderna and Pfizer. So while it may be that there needs to be a booster in the future for J&J, we don't know that yet for sure, nor do we know what could happen if the two interact. Finally, the Kentucky State Fair began today. Am I confident the procedures they have in place to prevent the spread of COVID? First, I really appreciated the events being outside today, even if some tried to lie that they were inside. Pushing things outside is good and it is smart. I also appreciate that the State Fair has required people attending to wear masks. Now, one thing I saw on the first day is not a lot of enforcement on that. The State Fair can and will be as safe as it can be, as safe as it can be, if the most people who go are vaccinated and everybody wears masks. The more unvaccinated and the more masked, especially those unvaccinated and unmasked, the more dangerous it becomes. So the preservation of our state fair and its safety is in our hands. We need to do the right thing. All right, we've gone long today. But again, folks, the situation is serious. Do the right thing. Do the right thing. It isn't politics. It's just right and wrong. It's life and death. We'll get through this. We'll get through this together. We'll be back with another update next week.